are you? Because we haven't seen necessarily the same uptick in deaths or hospitalizations, and even the own federal modeling doesn't necessarily project, I should say, that we might see that.
Yeah, I'm mildly concerned. I'm not nearly as concerned as I was back in the winter or last fall. For the reasons that you point out, we have vaccination now, and so the toil on our healthcare system and the likely death toll is not as high. Other things to consider are that we may not be looking at a fourth wave, but more like the transition to the endemic phase of this disease, which sometimes resembles a fourth wave. Having said that, rather, I don't mean to downplay the risk here. I think the message is we have to do everything we can to maximize uptake of the vaccine while at the same time slowing down the lifting of restrictions so that we have time to maximize the uptake of the vaccine so that is as little suffering as possible.
Here in Ontario, we're hearing about a potential move into essentially a stage 4 after step 3 of the recovery. It has to come at least 21 days after we have finally entered step 3, of course, which we already did. And then 80% of the population needs to have one dose, 75 need to be fully vaccinated. Now, we've hit 80% with one dose, just barely, and we're about 68% for those who are fully dosed. Is Ontario, in your mind, ready to move on to a more open province, less restrictions, and less gathering limits, especially when it comes to outdoor sporting events?
No. And this is going to make people angry. Here's why I don't think so. Those thresholds were set by the last round of modeling that was based on the alpha variant being dominant. And alpha, as everyone knows, is less transmissible than delta. Therefore, the thresholds for the number of people that need to be vaccinated must be ratcheted up a little bit. I would like to see 75% of people being doubly vaccinated. And I just pulled that number out of thin air. I didn't do any modeling, but it has to be a high number, right? And so this 80% with one dose to me is not particularly relevant because Delta doesn't respect one dose. Delta respects 2 doses. So take that one dose off the table entirely. Let's look at 2 doses. And we're about, 66% of people with 2 doses in Ontario, which is good. It's not good enough. So if we're going to be lifting restrictions at that level, I would prefer that we have more substantial population immunity to protect those who are not immune.
We're seeing no gathering limits for indoor or outdoor social gatherings. Restaurants are still going to maintain distance, but no capacity limits inside. The one thing that we have seen, though, masks are still going to be mandatory if we are going to have, much more indoor gatherings, much more people in businesses. Is keeping the mask restriction going to be enough in your mind, or are we just asking for trouble, especially by having no gathering limits for indoor gatherings?
The masks are critical. Here's why. I think everyone has come on board with the idea that COVID is spread by aerosol transmission, airborne. It's airborne, kind of like chickenpox. So the CDC actually said today that they think the Delta variant might be as transmissible as chickenpox, which is astounding. Chickenpox is crazy transmissible. If that's the case, then it really doesn't matter what your distancing protocols are indoors. If you're spending any kind of sustained time indoors with any number of people and somebody there has the Delta variant, everyone's going to get exposed to a very high level and has a high risk of becoming infected. There are 2 ways to prevent that. One is to have extraordinarily good ventilation control, and the second has to have a universal mask mandate with high quality masks, well-fitted N95 style respirators. These cloth masks don't cut it anymore. So the masks are critical. The second half of the question, though, is, are they enough? I don't know if they're enough. I like to think that if used to high capacity with a high quality mask, I think they will be enough. But that's assuming we're also using this time to increase vaccine uptake. So the takeaway for me is people have to remember COVID is airborne, which means high quality masks, which means indoor is never completely safe.
It's interesting you mentioned that CDC report, because one thing that stood out to me, and this report hasn't come out yet, but it has been confirmed by the CDC director to the Washington Post. So we can take what's in there as accurate, but some of the unpublished data shows that vaccinated people possibly could spread the Delta variant at the same rate as unvaccinated people. How much of a concern is that then for the spread of the virus, especially as we move into scenarios like school, in September, where we're going to have a large cluster of unvaccinated kids, but also vaccinated teachers who, while safe from hospitalization, may not be safe from spreading the disease either among staff or worse among students.
So that CDC data, we haven't seen all of it yet, and what little has been leaked, it's difficult to conclude anything from it. What little I know of it, they say that amongst those vaccinated people who got infected, the viral load was comparable to the unvaccinated people who got infected, suggesting they will transmit as much as unvaccinated people. But the caveat to me is there is always going to be a proportion of vaccinated people who do not mount an immune response. That's why the vaccines aren't 100% effective. A certain proportion just will not get protected. If that's the proportion that we're talking about here, it is not surprising that they will have similar viral loads to unvaccinated people. It may suggest that the majority of vaccinated people won't have viral loads in comparison, comparable rather, to unvaccinated people. So I'm reticent to take a lot away from that report yet until I see more information. But what we do know as well is that vaccines do reduce the probability of transmission. They don't eliminate them, but they reduce them. That's why it's important that we do everything we can to reduce the amount of infection in the community so that a tiny proportion of vaccinated people do not pass it on further. The more transmission in the community, the more likely that vaccinated people will become asymptomatically or symptomatically infected and be able to be conduits of infection. To answer your question directly, does that make me more concerned for the fall? I'm always plenty concerned for the fall, mostly because kids under 12 are not eligible for vaccination, and so I anticipate that a large number of outbreaks will be seen in the school environment unless we invest in the appropriate public health assets for schools, which include high-quality ventilation, mask wearing, and better public health assets wrapped around schools like testing and tracing and isolation.
Let's talk about a district that's doing none of that. Alberta is announced Wednesday they're dropping their mask mandate along with most of their pandemic restrictions over the coming weeks. People who test positive for COVID-19 will not have to isolate. Close contacts won't be notified. Testing is going to be dropping. Obviously, come school, that's going to be a real concern for parents in Alberta. But even right now, we are hearing from people across the province outrage at the decision that was made by the Jason Kenney government. Your reaction to their decision to say that we have hit the endemic step, the endemic stage of the pandemic, and it is time to wind down the restrictions and wind down testing in particular.
I saw a great tweet today that said, the pandemic isn't over just because Alberta says it's over. So my first reaction was, it's a curious thing to do, and it strikes me as unkind to those who are ineligible for vaccination. That means those under 12. Unkind to those who did not mount an immune response. Unkind to those who are still waiting for a vaccination but haven't been able to get one yet. And it's kind of like saying to the unvaccinated, hey, you're on your own now. Right? And that might strike someone as a solid libertarian perspective to take, but it's not good public health policy, because only about 65% of Albertans are fully vaccinated. So a third of the province are susceptible. Epidemics are all about how big the susceptible population is. And a third of your population, well, that means if the disease runs roughshod through that population, that's a high number of people possibly going to the hospital. And remember, they will go to the hospital because they're not vaccinated. It's a high number of people taking a toll on society. It's likely going to create a fourth wave unless mitigation tools are put into place. So I don't know why they're doing it. I could make some guesses. It could be ideological. I don't know. I'm going to assume that other people were involved in the decision-making, like the laboratories, like the testing regimen. I don't know. But it does not strike me as a wise thing to do at this point. At some point in the future, we're all going to have to do something similar. We're going to have to lift everything and sustain and tolerate whatever level of transmission we have. But the time is not yet now, because at some point later this year, vaccines will be made eligible to kids under 12. And when that happens, we get closer to population immunity. And when that happens, we can start lifting some things with more confidence. So I'm not a fan of that decision.
That was actually going to be my next question for you: is when do we hit that stage of the pandemic? Is it then waiting until children can get the vaccine, waiting for those Moderna test results, those Pfizer test results, and we start seeing a larger percentage of children being able to be vaccinated?
That makes me uncomfortable. I don't like the idea of relying on children to give us herd immunity. That's not a great message to send to your kids, but that will make a huge difference. Other things that matter is, will we need a third dose? A third booster will ratchet up our efficacy scores from somewhere in the 80s to somewhere in the mid to high 90s, possibly. Will new vaccines like the Novavax vaccine make a change? When will the rest of the world be immunized so that we're not re-importing infection and creating more variants in hot zone areas like India and Brazil? When those things happen, I'll be a lot more comfortable. But locally, we've got a good shot at achieving manageable endemic disease, which is not great, but it's manageable, especially if we monitor the borders for reinfection and prevent unnecessary transmission locally. I'm an idiot optimist. I like to think we're going to make good decisions, at least here in Ontario, that will allow us to have a fairly good fall. But we could screw up in any number of ways and create a genuine fourth wave. But I don't think we will. I think we learned our lesson, and we're going to do some good things.
I like your optimism. I'm going to leave it there. I'm hopeful that you are correct, and that while we may see a slight increase, that things will be manageable in our province. Dr. Deonandan, thank you so much for joining us. As always, a pleasure to speak with you.
Thank you.